The World Health Organization is powerful. It shapes global health policies and influences billions of lives. But did you know it has no real enforcement power, and that its funding depends on the political agendas of a few nations? In a world where pandemics and politics collide, the WHO's future is uncertain. Let's uncover the hidden forces that shape the organization we rely on for our survival. Founded in 1948, the WHO was created to keep us healthy, fight outbreaks, and make sure no one ignores global health crises. Sounds great in theory, but here's the twist. It's stuck in a never-ending geopolitical tug-of-war. The WHO is both a scientific authority and a political player, but with one big problem: it has no real power. It can recommend, warn, and advise, but it can't actually force countries to listen. Unlike national health agencies, it can't override governments or enforce its own policies. Instead, it relies on diplomacy and cooperation, which is, well, not exactly a foolproof system when global politics are involved. And speaking of politics, let's talk about money. The WHO gets some baseline funding from its 194 member states, but most of its budget comes from voluntary contributions, meaning countries, private donors, and even corporations decide how much they want to give. Sounds generous, right? Not exactly. Because when money isn't guaranteed, it means those who donate the most often get the biggest say. Wealthy nations and major foundations end up steering WHO priorities toward what they think matters most, whether or not that aligns with actual global health needs. This means the WHO's focus can sometimes shift toward politically convenient or high-profile health issues, while less glamorous but equally urgent problems get sidelined. This tension between politics and public health becomes most obvious during global crises. Take COVID-19, for example. When the virus first emerged in China, the WHO publicly praised the Chinese government's response. But as the pandemic worsened, the organization was accused, especially by the US under the Trump administration, of being too soft on Beijing. The drama escalated to the point where the US actually announced it was leaving the WHO in 2020, citing bias and poor crisis management. The decision was later reversed by President Biden, but the whole saga revealed just how easily global health governance can get tangled in geopolitical rivalries. Beyond funding battles and diplomatic spats, the WHO also plays referee when it comes to vaccine distribution and medical resources. During COVID-19, it launched the COVAX initiative, a program meant to ensure that vaccines were distributed fairly across all countries, rich and poor. Great idea, except it didn't exactly go as planned. Wealthier nations, unsurprisingly, prioritized vaccinating their own populations first, securing massive portions of the vaccine supply, while lower-income countries were left waiting. This highlighted a brutal reality. When national self-interest clashes with global cooperation, the WHO has little power to enforce fairness. Of course, the WHO's issues didn't start with COVID. Controversy has followed it for years. During the 2014 Ebola outbreak, it was criticized for responding too slowly, which may have cost thousands of lives. Then there was the 2009 H1N1 pandemic, where the WHO was accused of exaggerating the threat, some say under pressure from pharmaceutical companies looking to cash in on vaccine production. These incidents raise a tough question. How much of the WHO's decision-making is based purely on science, and how much is influenced by political and economic pressures? And then, we have the influence of global superpowers. Countries like the United States, China, and the European Union hold enormous sway over the WHO, not just because of their funding, but because of their broader geopolitical ambitions. The United States has historically been one of the WHO's biggest financial backers, often using its contributions as leverage to push for reforms or exert influence over policies. Meanwhile, China has been steadily increasing its involvement in international organizations, including the WHO, as part of a larger strategy to reshape global governance in its favor. The result? The WHO is constantly walking a tightrope, trying to maintain neutrality while balancing the competing interests of major powers. And if that wasn't complicated enough, the WHO also struggles with its own internal challenges. It's a massive bureaucracy, meaning decision-making can be frustratingly slow. Coordination between different regional offices isn't always smooth, and because it has to work through national governments, its ability to act quickly in emergencies depends on whether countries are willing to cooperate. And let's be real, sometimes they're not. If a government decides to downplay or outright hide an outbreak for economic or political reasons, the WHO has no real power to force transparency. That's a pretty serious flaw for an organization whose main job is to prevent global health disasters. But here's the thing. Despite all these issues, the WHO is still necessary. Without it, there would be no global system for tracking disease outbreaks, no coordination for vaccine distribution, and no international health standards. The real question isn't whether we need the WHO, but how it can be reformed to actually hold its ground in an increasingly chaotic world. Some argue that its funding model should be overhauled, making contributions from member states mandatory instead of voluntary to reduce outside influence. Others suggest giving it more enforcement power, though that raises concerns about national sovereignty and the risk of overreach. At the end of the day, the WHO isn't just a health organization, it's a reflection of global politics itself. We live in an era of rising nationalism, geopolitical fragmentation, and an increasing number of health threats, from pandemics to climate-related illnesses. The WHO's future depends on whether it can maintain its credibility as a truly independent health authority, or whether it will continue to be pulled in different directions by competing national interests. Ultimately, the WHO is imperfect, political, and sometimes frustratingly ineffective. But without it, the world would be in even worse shape the next time a global health crisis hits. And let's be honest, it's not a matter of if, it's a matter of when. I'll leave you to discuss in the comments. Should the WHO be given more power, or would that create even bigger problems? Let me know what you think. Don't forget to subscribe if you haven't already. Take care of yourselves, take care of your loved ones, and I'll catch you soon in another video.